I'm going to talk a little about grading PVS severity. Let me just pull up my slides. Okay, great. So this is what the registry is asking for each vein. So what is the severity of PVS in the blank vein at this time? And here are your options. So really almost everything by default is normal to moderate, where there is somewhere between no stenosis and up to 70% stenosis. And the best way to characterize that is to understand that the narrowest portion, where the vein's the smallest, is at least 30% of the upstream vessel. Okay. And then if the narrowest portion is less than 30% the size of the upstream vessel, then it's severe. And then if there's absolutely no flow or it's lost its connection to the heart, then we call that atretic or atresia. There are situations where there's diffuse narrowing of the entire vein, where it's very, very small, hypoplastic, and that would be graded as severe as well. And I'll show you some examples of that. And then there's a follow-up question that's asked, is there stenosis or narrowing of the upstream branches of the blank vein, i.e. segmental or subsegmental branches? So the connection to the heart of the vein is at the veno-atrial junction, and that's the most common area of stenosis. Stenosis can be more upstream, which I'll show you examples, but then the pulmonary vein divides like branches on a tree, and those individual branches are called segments or subsegments. And if there's diffuse narrowing or stenosis in those branches, then we will click yes to that question. So I decided to approach this kind of vein by vein just to show you what angiography looks like, including normals, and then we'll just grade each one as we go through it. And so let's start with the right lower pulmonary vein. And this is called balloon wedge angiography, where we have a catheter coming up from below, and then it courses all the way out to the right pulmonary artery, and then we are pushing contrast into the right lung. That's that black opacification initially, and then the contrast goes through the lung, and then what we call levophase is the contrast now coming back through the pulmonary vein here into the left heart. And so this is the front to back angulation, or the AP, and then here is the lateral. And you might need both views to really see the caliber of the vein as it enters the heart. And you can see here, specifically in the lateral, that the vein is nice and tall with no narrowing as it enters left atrium. So this is normal. A couple more examples. Another wedge injection of the right lower pulmonary vein. This one, we don't need the lateral projection to see that the vein is nice and tall. There's no tapering, there's no stenosis as it enters the atrium. Another injection that we can do is injecting up into the vein, or retrograde, or against blood flow. And that is done with this catheter here. So it's injecting contrast into the right lower vein, and we can nicely characterize the entire vein only without seeing any of the pulmonary arteries, as you do during the wedge injection. Okay, and so here's what I mean by the... So instead of the vein having its own consistent diameter leading into the atrium, it narrows down here. Okay, this is the ostial stenosis. And what we do is we take a measurement here and then upstream. And if this measurement is greater than 30% of the upstream, then that would be normal to moderate. And if this measurement is less than 30% of the upstream diameter here, then that would be severe. And obviously, if there's no connection between the two, it would be atretic. And so this is going to be, this is about 50%, so it's going to be in that first normal to moderate category. A couple more examples, the right lower. Here, a little bit challenging to see this one. This is what you're going to get. You're going to get variable injections. We can't always do perfect angiography. That's the goal. But at times it's not going to be ideal. And so here, barely see right from there to there is the measurement compared to the upstream vein, and that's about around 30%. So that's actually going to be severe. And then this you can see that we are injecting to the right lower pulmonary artery here, and then what comes back is the pulmonary vein here, and then ends in a blind ending stump, and it does not connect to the left atrium there. My goodness. Here. Okay, so this is atresia. This is atresia of the right lower pulmonary vein. All right, well, the computer was really excited to talk about right upper vein, so we're going to get right to it. So here, this is the wedge injection in the right upper pulmonary artery. And what I warn you is that it can be challenging to opacify the entire right upper pulmonary artery, and certainly difficult to opacify the right upper and the right middle together, as the right middle frequently joins the right upper. And so what you typically get is a segmental injection, or maybe just the right upper as it comes back. And here it looks like there might be some narrowing as the vessel courses through into the heart, but we really don't have an accurate picture. This compares to, this is the same patient where we have a retrograde picture, which is much better. And so try to use these when you have them to grade your stenoses. And you can actually see that the vein connecting to the heart is wide open. However, upstream of that, you have narrowing of the upper and the middle here. And so there is segmental disease in this patient, which by default will be severe. So we're going to call this severe. Also, if you have a catheter up into one of the segments of the vein, and that is the only segment you're injecting, you may either overestimate or underestimate the stenoses because you're not seeing flow coming in from all the other segments. And so just recognize that a segmental injection retrograde into a vein is not ideal when trying to characterize the severity. This is the same patient now opacifying the entire tree of the pulmonary vein, and they can now more easily show that that's going to be in that 30 to, I'm sorry, that's going to be in the normal to moderate range. Also the right upper. Now here is a clear example of kind of the diffuse hypoplasia from severe stenosis. And what happens is blood diverts away from this lung and goes to other veins that are more open with less disease. And so the vein can shrink down and become hypoplastic, or the disease within the wall can progress more upstream. And so you can have diffuse progressive disease of this vein. And either way, this is severe because there's diffuse narrowing and there's upstream narrowing. So you're going to check that box as well. Okay, let's move on to the left upper pulmonary vein. Here, this is going to be a wedge injection in a segment of the left upper. But however, because there's such severe stenosis, when you inject that upper, that in on levo phase, the blood comes back into the upper segment of the pulmonary vein, but then it hits that severe stenosis, and then it goes backwards and fills the rest of the tree, the vein, and all the segments nicely. Okay, and so it's not atretic. There is a little puff of contrast going through here, but this is going to be severe with kind of diffuse upstream narrowing. Here's that same patient now injecting into that vein. And the luxury of severe stenosis is that usually the catheter nearly occludes the vein, and it can show you the entire pulmonary vein and all its branches. Okay, this is also the left upper pulmonary vein. And here's just a sample of, sometimes you do need two views, both the A camera and the B camera, AP or lateral. Because here, it shows that maybe this is just trivial narrowing, but when you look on the lateral here, you can see that it's more than trivial, and so and it's more than just compression because there's changing caliber between the upstream vein and the ostium here, but it's more oval in appearance. So this is not quite severe. It's still going to be in that normal to moderate category, but just to show you, it's helpful to look at both views when assessing severity. This is example of a left upper pulmonary vein that has segmental upstream narrowing. Now, this picture was taken after balloon angioplasty, so this initially was severe, but then you can see all the kind of irregularities and some narrowings of the segmental branches upstream. And so it would have been called severe, but we're still going to check that box that there's upstream narrowing. Similarly, we have this vein where it's now more clear that there's involvement of the segmental branches. This one's kind of diffusely small, and then you have stenosis extending into the apical segment before it gets bigger. There's stenosis at the proximal anterior segment there. And so this is upstream disease. And also severe stenosis. Okay, how about the left lower? Probably the most tricky vein to characterize severity, particularly on a wedge injection. You strive as the operator to fill almost the entire lobe if you can. It's kind of tricky to fill the superior segment at times, particularly in an older child. But in this case, we fill the entire thing, and then you're just going to watch it flow through, and it really does look nice and tall from here to here as it courses into the heart. And then this is the lateral projection, and it's common for us to see that there's some anterior-posterior narrowing here as the lower vein courses between the aorta and the heart. But as long as it remains tall in the superior inferior dimension, then that's going to be okay with no disease. So this one's normal. This is another example of the left lower through a wedge injection. But if you look at this time, look at this example, and we have the pigtail here marking the aorta. Here you're going to see, I know this catheter is kind of in the way, but there's some subtle tapering here, right here. So there is some narrowing of this vessel. It's not severe. We're going to put this in the normal to moderate category as well. And the lateral shows the anterior posterior distortion, but just this example kind of is just the other side where you can have anterior posterior compression of a normal vein, but the key is it remaining tall superiorly and inferiorly as it enters the heart? In this situation, it is not. So there is PVS in this vein. And then we have a bunch more examples. We're actually injecting into the vein, as I mentioned, when the stenosis is severe and the catheter nearly blocks the flow. In this case, it completely occludes the flow. Then it would pacify the whole pulmonary vein, and that's severe. This is going to be that normal to moderate category, even though the vein is small for age, but it's not kind of diffusely small. And this is going to be that gray area, unfortunately, that we have with some of our patients where it's not severe enough where it's diffuse narrowing or there's upstream involvement, but it's also not tight enough to call it severe. So this is going to be the normal to moderate, even though we know that there is some hypoplasia to that upstream vein. And this is a more easy example to classify. This is severe with the long sheath, nearly occluding it, not completely occluding, but nearly occluding it. Okay, how about right common veins, where all the veins come back through one vein on the right side? There's some funky patterns that we can get from time to time. Sorry, this geography is terrible, or this video is terrible. But you see all the veins of the right lung coming through and then narrowing here, probably to about 50%. So this is normal to moderate. And then this is a little bit of a odd pattern, but again, all the veins, even though it looks like a hand with fingers kind of coming back to a pretty tight, severe stenosis there. Okay, how about the left? All right, here is a left common vein. So all the veins from the left lung coming back through this orifice here. The sheath doesn't block it, and you have to look at it a few times, but it's not severe. It's going to be about moderate, 50% normal to moderate. This, however, is more severe in the left common. And then this is an example where all the veins come back. Great. and so this is a left lower wedge injection. The left lower vein is coming back here. It hits this atresia, and then it retrograde fills the rest of the vein. So this is atresia of the left common vein there. And then I just have one slide showing that we can also grade these veins using other types of imaging, some non-invasive imaging, CT and sometimes MR. And it can be easier to grade the severity if you have good pictures. The limitation is the resolution of the pictures. But here's an example of 3 vessel disease in this one patient, right upper, and left lower. But the resolution is not perfect, as you can see, to potentially tell you what exact percentage it is, but you can kind of get a sense that these are probably nearly all going to be in the normal to moderate category. The left lower looks like it is severe, but the resolution isn't that great to tell for sure. Okay, so that's the brief summary of grading PVS severity. Please email me if you have questions.